Where do Kamala Harris and Donald Trump stand on the future of the Affordable Care Act? Chris Graham for Augusta Free Press here, and it's worth examining. I don't care what you uh, have been led to believe or what you may even think actually think are the most important issues in the 2024 campaign. It's got to be healthcare. If you don't have health, what do you got? If you don't have your health, you got nothing. And so, the fact that we've got two very different visions on what to do about health insurance, which is the way you can access health care, it's going to be a clear issue in this campaign. It's a dividing line in this campaign. Before the Affordable Care Act, also known as Obamacare, enacted in 2010, 50 million Americans didn't have health insurance. And it's just amazing. It was almost 18% of the adult population didn't have health insurance. Obamacare has literally halved that. We're down at the 25 million range, which is still 25 million too many. But a big reason for the cut is 21 million people are enrolled through the health insurance marketplace. So a large number of the folks who just didn't have health care, didn't have access to it for lots of reasons, have been able to get health care through this mechanism created by the Affordable Care Act. Now, what does the future hold for that? Kamala Harris, the Democratic Party presidential nominee, the sitting vice president, has in the past supported the Bernie Sanders Medicare for All proposal. That honestly is where we need to go. That would create a universal healthcare program for the entire country, and that's where we need to go. But in the meantime, given the political reality, and here's the political reality that we're all in, Republicans in the Senate would certainly filibuster Medicare for all if and when it ever got to the floor for a vote again, as long as they have more than 40 in the Senate, um, and as long as the Democrats continue to treat the filibuster like it's sacrosanct, which it isn't. But as long as that's the reality, we have the Affordable Care Act, and that's the best we're going to have. Um, and again, it's halved the number of people that we have without health insurance in this country significantly. 25 million people have been able to get into the health marketplace or other health insurance plans in the last 14 years that wouldn't have otherwise been able to. And so Harris has said she wants to see us build upon that success. Donald Trump, her Republican opponent, the ex-president, tried for 4 years to undermine the Affordable Care Act during his term in the White House. He still very much wants to get rid of it. But get this, he wants to get rid of it without having anything in terms of an actual idea to replace it. What he said at the September 10th ABC News debate was, I have concepts of a plan to replace Obamacare. And, that's earned him a lot of online and otherwise derision from his critics because he's had 9 years since he started railing against the Affordable Care Act to come up with something more than the concepts of a plan. And that's all he still has. Another quote from that debate, I'm not president right now, but if we come up with something, I would only change it if we come up with something better and less expensive. And there are concepts and options we have to do that. And you'll be hearing about it in the not too distant future. That was 2 weeks ago. Depends on his definition of not too distant future. I suppose maybe 9 years is not too distant for him. Um, Now, to stress again, the reality is that even though we've halved the number of people without health insurance in this country, 25 million people still without health insurance is 25 million too many. It's not, there's no acceptable number for that, given our status in the world as the only major industrialized nation that does not have a universal healthcare program in place for its citizens. Um, but the idea that we'd not only not work to continue to get that number closer to zero, but we instead would arbitrarily get rid of the one thing that we've found in the past 50 years to get more people in the regular healthcare without having an alternative. That's the height of irresponsibility on the part of Trump and Republicans. And again, aside from having concepts of a plan, all they do is throw broadsides at Democrats. Here we go again with another quote from Trump at the September 10th debate. Obamacare was lousy healthcare, always was. It's not very good today. And when I said that if we come up with something, we're working on things, we're going to do it, and we're going to replace it. And then he actually, after he said those words, those exact words, he claimed that uh, he had saved the Affordable Care Act, which is interesting because he had tried over 60 times to repeal the Affordable Care Act. Um, and We all remember the John McCain episode. John McCain, who had just been diagnosed with brain cancer in the summer of 2017. He would die a year later from that brain cancer. Had to almost pull himself out of his hospital bed to go vote in the United States Senate. He cast the deciding vote no, the thumbs down no, on Trump's most significant and closest effort at actually repealing Obamacare. And this is the guy who claims that he saved Obamacare. It's hard to figure, and it's lying. He's downright physically lying when he says he saved Obamacare. Now, what Kamala Harris said during the ABC News debate September 10th, what the Affordable Care Act has done is eliminate the ability of insurance companies to deny people with pre-existing conditions. If you're a person watching this with a pre-existing condition and you have health insurance, you can thank Barack Obama and Democrats for having the guts to go through with passing the Affordable Care Act, even though it cost Democrats the control of Congress in the 2010 cycle, and arguably led us to where we are now in terms of the vitriol, uh, the extreme, uh, the most extreme parts of the Tea Party movement came to life after, and because of Republican responses to the passage of the Affordable Care Act early in 2010. Harris went on to say at the debate, I don't have to tell people watching tonight, you remember what that was like. Remember when an insurance company could deny if a child had asthma, if someone was a breast cancer survivor, if a grandparent had diabetes. These are simple things. Thankfully, as I've been vice president, Harris said, over the last 4 years, we have strengthened the Affordable Care Act, and we have allowed for the first time Medicare to negotiate drug prices on behalf of you, the American people. And she hit this point really hard. Donald Trump said he was going to allow Medicare to negotiate drug prices. He never did. The Biden-Harris administration did, she said. And now we've capped the cost of insulin at $35 a month. It's obvious where, if you're going to value your continued access to health insurance, and if you're not upper middle class, if you're, if you're of the means to be able to afford great healthcare, and I'm one of those people. Fortunately, I was not as recently as 5 years ago, but now I can afford a very good healthcare plan. Um, but my first foray into the healthcare market was through healthcare plans that were made more affordable by the Affordable Care Act. I went without health insurance for a long, long time. My wife and I did both, because we were and are small business owners who could not pool, could not afford what was available for the longest time, and only because of ACA and now because of our improving fortunes in the last 3 years, particularly economically, have we been able to be able to afford our own health care without having to go through the health insurance marketplace and that kind of thing. But if you're one of those people out there who still needs to access this is a great resource for you. And perhaps you should vote accordingly. I don't know, is the closing message here. We're going to continue to cover issues in this campaign. I'm not sure, how many people still need issues-based reporting. A lot of people claim they do, and then, especially the Trump supporters will tell you, boy, that Kamala Harris doesn't really have a lot of specificity in her plans. I don't know where she stands on the issues, as Donald Trump complains about uh, whatever is on his mind at the time, I guess. There's very little, if anything, in terms of anything close to specifics, especially on healthcare, where he has concept of a plan. But we're going to continue to do our best to try to give you a fair reading of where the two major party candidates stand on the issues to help you make your decisions if you need some nudging there in that respect. If you have any questions for us in the meantime, you want me to look into a specific issue, you have a news tip, anything of that nature, please feel free to email me at chris@augustafreepress.com.